Perfect. Well, thanks. We're going to actually move on now to the next presentation, which is navigating your new diagnosis. We have a great panel to sort of cover what some of those issues are as you're newly diagnosed. So I'm going to switch that over to them.
Good morning, everybody. Can everybody hear me okay? Yes. Laura, maybe you should unmute. There you go. Thank you. Thank you so much. So we'll get started. And I really just want to thank the Kidney Cancer Association for asking me to moderate this session. It is an important one. And as I've been thinking about it, I realize that it's kind of a finite time in a patient's journey, so to speak, where they're finding out their diagnosis, they're figuring out what to do. Sometimes they don't feel so well, and they're just getting a lot of information, and they need somewhere in some direction as to how to proceed. I just wanted to set the stage for that because it's critical. And everyone who's going to be speaking in the next 35 minutes is really telling their story, and they are their speakers, and I am just the moderator here. So, what does it look like? And I'll just kind of give some background information. Many patients that are diagnosed with kidney cancer present with a variety of symptoms. Sometimes they're asymptomatic, and it comes from another type of workup for another medical condition. Sometimes somebody just hasn't been feeling quite well for some time, and their doctors are trying to figure out what's going on. And for others, they have a sign. They have perhaps blood in the urine that tells them, I better get to a doctor right away. So the presentation of kidney cancer is quite varied and sometimes difficult to diagnose, and especially difficult for patients who many of them didn't even think they could get cancer of the kidney because it is rare. So I'd like to start this session by introducing our terrific panel, and they're going to tell their story. And that's what everybody needs to hear because it's an important one. So the things that I think people would like to know about when you were diagnosed, if you are aware of your histology, which I'm sure you are, please, share that and let everybody know why that was important, not only to you, but to everybody else. And then tell us about those first couple days or weeks and what it was like until you got to the right doctor. So because Laura is to the left of me, we'll start with Laura.
Thank you so much. My name is Laura Espeller. I am a survivor of metastatic kidney cancer. I was diagnosed in May of 2016, 5 days after my 29th birthday. I call it the worst birthday gift I ever received. And, I had been feeling not great for, months, if not a year or so, suffering from migraines and had high blood pressure. And, sometimes I'd be sitting at my desk at work and I could just feel my heart racing. And I kept going to my doctor, and my primary care at the time said, well, you're probably just overworked, tired mom. I had 2 kids in middle school at the time, and I had a really stressful job, and you need to lose weight, of course. That's what they always say, right? And I almost felt like I was being a hypochondriac at one point. And then right after my birthday, I had the worst back pain in my life, and my legs started to swell, and I knew something was definitely not right at that point. And so I went to my primary care, didn't get the answers that I wanted to hear. And so I went to the ER that night, and it was in the ER that the doctor came in and said, you've got a 12-centimeter tumor on your kidney, and you need to go to get surgery right away. And so that was a shock, obviously. It wasn't what I was expecting. No one in my family up to that point had been diagnosed with kidney cancer. And of course, I was much younger than most kidney cancer patients are. And so it really was, very upsetting and overwhelming to understand. Again, I was stage 4 at that point, and the tumor had grown into my vena cava, which is the massive artery that brings blood to your lungs or legs back up to your heart, which is why my legs had swollen. But I was really fortunate to be transferred from that amazing ER doctor into a urologist that was able to arrange for me to get care in California. I was in Nevada at the time, and sign me up for surgery. But those first days and weeks were just a blur, quite honestly. I was trying to understand what was going on. I was overwhelmed, had a lot of anxiety, and was in a lot of pain because of my situation at the time. And so it was very overwhelming. But, fortunately, I had an amazing experience. After my surgery, I joined a clinical trial, and I have HLRCC, which is a genetic form of kidney cancer. It resulted in me having papillary kidney cancer. And I joined the first clinical trial for papillary kidney cancer patients with metastatic disease specifically. And I had a complete response to treatment. So I've been in ED for about 4 years now, and very grateful for that.
Wow. Amazing, Laura. Thank you. Really terrific story. We'll touch upon a lot of those issues as we get further on, but thank you very much. Hi, Marissa.
Hi, how are you?
I'm good, thanks.
Good. I'll go ahead and share my story. I was diagnosed in May of 2013. At the time, I was 38 years old. So also another young person that got diagnosed and did not expect that at all. A garden variety of cancers ran in my family, but kidney cancer was not one of them. And most of my family members, when diagnosed, were diagnosed much older than myself with their cancers. I found out that I had kidney cancer on a whim. I was feeling great. I was working out, and one day I got home from the gym and noticed that I was having kind of some flank pain on my left side. I thought, gosh, I just did it too hard today. Worked out a little too hard. But the whole evening, it just didn't feel right. So I ended up going to an urgent care, and they really didn't have even sonogram or anything. They did an x-ray and said, we'll just see if we can see anything. And all they could see on my left side was a cloud. They said, it's just a mass. It looks like a cloud. We don't know what this is. You need to get seen right away. So got in to see my primary the next day. There in the office, she did a sonogram. We had that done, and it was obviously very urgent that I go see a urologist. Mine was also a whirlwind. Within 10 days, I had seen my primary, got referred to a urologist, and I'm in the Kansas City area. So I go to KU Medical Center and Cancer Center for all my treatments, and that's where I was referred. Within 10 days, I was having every test under the sun, bone scans, everything, just to see if that was all that was going on, if it was just in the kidney. And luckily it was at that time, 12 centimeter by 10 by 6.5 tumor. So it was already stage 2 when I had a radical nephrectomy done in May of 2013. I was clear for about 8 months after that, and then actually had some gallbladder issues and had CTs done and found that it had metastasized to the lung about 8 to 10 months later. So have really been metastatic ever since 2014. At that point, the mets were small, so I had actually went on active surveillance for 3 years. It was very fortunate, and still am, that it's slow growing. It's not aggressive whatsoever. So it's given me a lot of options for treatment, and have been able to, be a mom, live a normal, busy mom life with kids. And But then in 2017, one of the meds finally got up to a centimeter. So biopsied and talked to my oncology team about, what are some treatment options. So then ended up going with, if it's a little bit older treatment that's been out there for quite a while, but it's called IL-2 or interleukin 2, high dose IL-2. It's also referred to as. It's an inpatient immunotherapy. It's very grueling. But for me, it worked. It kept, I went through 2 rounds of it, multiple doses each round, and kept me stable for a little over 2 years. It, didn't shrink anything, but it kept me stable. And I was so grateful for that. Really kind of got my life back for a couple of years after that. Then, of course, last year, as we all know, the pandemic hit in March of 2020. And that's also when I found out I had a little bit of progression and some growth. So I'm now currently on targeted therapy. I take Votrient, and it's been very successful. It's actually shrank the nodules I have by half. So I currently have 5 in my lung, and they're all under a centimeter. So very lucky still, I feel like, and the drug is working. It's kept everything stable. Has its side effects, but with my team, we manage those, and it's still letting me have a fairly productive life. So I'm surviving and fighting at the same time.
Yes, you are. And Marissa, I am familiar with IL-2 therapy. It was the only treatment that we had for about, a good almost 2 decades before these targeted therapies started to be approved for kidney cancer. So I clearly know what you went through, because treated hundreds of patients with IL-2. And I'm glad it's a memory for you. Yeah. But obviously a positive one. Yeah. And no, you're looking great, and sounds like you feel really well, and great. Good course for you. Yep. Thank you.
Uh-huh.
Hi, Chapman. You had to unmute. Okay, there you go.
Oh, okay. Hi, good morning. How are you?
I'm good, thanks.
Great. Thank you so much for having me. I'm in rainy Vancouver, in Canada right now. So,
okay.
Yeah, and it's an honor to be here, and thank you for having me here. I received a cancer diagnosis after 2 bouts of hematuria. So I had no pain. I'm a kinesiologist, and so I understand exercise well, and I train other people to stay fit, and I've helped people with their cancer journeys. I'm not sure if it was foolish for me to think that maybe it wouldn't happen to me because I was participating, but it was quite a surprise at 44. I was playing volleyball, and then afterwards, went to the washroom and noticed a tinge of pink. And then following the match, I urinated again, and it was more of a purple dark color. And I don't think I've ever seen that before or heard of that before. And so quite alarming. Still no pain. So I thought maybe it was kidney stone. And my wife is a emergency room nurse, and she tried to talk me down because I was quite alarmed by what I saw. And we went to I went to see my primary care physician, and he ordered an X-ray ultrasound. And so we did that, and they discovered a 4-centimeter tumor in my left kidney that was consistent with renal cell carcinoma. I got that news the day after Father's Day. I'm a father of 3 little girls. At the time, they were ages 10, 7, and 5. And so I was in the doctor's office with my children because my wife was working at the hospital. And I took a picture of the sheet of paper that my doctor had given me, and I sent it to my wife. And for anyone who's sending information, I would say preface it before you just send out a sheet of paper, because I was in absolute shock. My kidney cancer diagnosis was, what happened was I then followed up with going to the emergency room. And then after the emergency room, I got an emergency CT scan. And then it was followed by biopsy a week or so later to really confirm that it is kidney cancer. And then it was scheduled for surgery. All in total, it was about 71 days for my kidney cancer kind of roller coaster ride, and dealing with mental health issues and anxiety and stress has been a big part of my journey. And so being able to share my story and be proactive and help others along has been really beneficial for me. I have a very rare type of kidney cancer called chromophobe kidney cancer. And so, I've just been able to connect with others that have kidney cancer because, of course, I'm concerned with my children getting cancer. I'm the first in my family to kind of have cancer, and it was kind of a big wake-up call.
Sure. Well, thank you all for articulating your stories so well. And many of you are touching upon items that we're going to talk about later. But let's kind of zero in on that first visit with your specialist. And fortunately, it sounds like all of you got to the right people in a fairly timely manner. So I thought this was a kind of an interesting question, is with all the doctors that you have seen from the time you were not feeling well to being worked up, how do you figure out who's the right person and who's on your team and who are the people that you're going to need moving forward? And, feel free to jump in anytime. You can take it from here.
I think that's an interesting question. And I think it's kind of, especially in the beginning, it's hard to know. I mean, I didn't give any thought to my kidneys before I got diagnosed, right?
Right. No.
I knew it was an organ clearly, right? But I had never given so much thought to this one tiny, organ. I think, really the first thing is to figure out, who's going to be your head of the ship, so to speak, right? So what doctor is going to be the one that's going to really be steering kind of everyone else. I think that depends on what stage you are when you're diagnosed. So for me, the first step was to go to my urologist, and he was the one that set me up with a urologic surgeon who did my surgery and did my radical nephrectomy. After that point, I'd become so comfortable with my urologist, my surgeon. I thought, wait a minute, you're handing me over to another doctor? No, and so that was kind of hard to accept at first, but then they sent me over to my oncology team. And for me, I actually didn't have a very good first experience with my first oncologist. He just didn't do a very good job answering my questions and explaining to me, the issues that I had. He couldn't even explain to me what my histology was or what type. And so I said, you know what, I've spent a lot of time just accepting answers without asking questions. And I didn't feel comfortable with the answers that he was giving me. And so, I thought I was doing the right thing going to a specialty center. And I still believe that I did. By far and away, they definitely saved my life with the surgery that they did. But he actually referred me to a local oncologist in Las Vegas where I was living at the time. And I kind of did that dance of, do I trust a new oncologist, with a new issue, right? And is he going to be the one to give me the answers that I want to get? And I debated myself, and it was even a little bit of contention within my family of, well, Laura, you really should stay with the specialist in California, right? Why are you going to a specialist in Vegas? But the moment that I walked into my first appointment with my oncologist, Dr. Vogelsang in Vegas, I knew he was the right oncologist for me. He sat down calmly, explained everything about my specific type of kidney cancer, went through all my options. And that right away made me so comfortable that I knew that that was the person that I wanted leading the ship. And so now, ironically enough, I live in California. I've moved to California since, but I still drive back to Vegas to see Dr. Vogelsang because he's the person that I trust. He's the one that I know. I feel comfortable with him, giving orders to my other doctors and everything. But it does take an entire team. And, I also think it's important to have a social worker, a psychologist on your team, a therapist, having those resources, everyone needs to be working together.
Yeah. Thanks, Laura. How about for you, Marissa? How did you figure out who your team members were going to be?
I was fortunate in that my primary referred me on to the KU Cancer Center, and here in the Kansas City area, they're very well known for cancer treatment, for research being that's, of course, a teaching hospital and clinic type of setting. And that's luckily where I would have preferred to have gone anyway. Had just known some other people with good stories and good outcomes.
Right.
So got connected with a urologist there who also ended up doing my surgery, my nephrectomy. And that team, between him and the residents, they were just there to answer every question. Right after my nephrectomy, I was getting calls every other day the first week when I got home, just checking up on me, how am I doing? Just anything that they could do. And then really we had a pretty good relationship until I had to go on the IL-2. Just kept working with the urologist. He specialized in urologic oncology as well. So that was kind of a nice add-on there too. But, once it got to the point where we need to look at further treatment that was outside of surgery,
right,
then, of course, they all worked together in that group. So he referred me on to an oncologist, went to that oncologist, and he gave me some options and said, there's this other oncologist we have here in our practice that specializes in the IL-2 therapy. And so went to see him, and he specializes in IL-2, I guess, here in the Midwest overall. It's where I guess a lot of people come for it. So just, knowing they were all working together to work on my case just made me comfortable. They were all very patient. They let me ask questions. Going through the IL-2 therapy was a very big deal. It's got a lot of side effects that are tough and can be even a little bit debilitating when you're going through it. So just, having that team of patient people that will let you ask questions, that will follow up with phone calls. I knew that's where I wanted to stay. There's options, to go to some of the larger places, like an MD Anderson, a Mayo, that are very well known, but I felt very comfortable right away and just felt well taken care of. And I think, you trust your gut, like Laura alluded to.
Yes.
If you don't feel like that's the right group for you, keep searching, get that second opinion. And, because you're the one that they're taking care of. And if you don't feel like you're being taken care of, then it's okay to keep looking,
Yeah, absolutely. I think one of the points that I've heard is that, once you see the urologist and, you think that everything's been taken care of, perhaps we don't do a good enough job of saying there's a possibility you may have to see a medical oncologist after. And maybe it's something you just can't even hear at the time. But, the care does transfer over, indeed. And even in today, which is very different than how we would treat patients years ago, is, we see patients after a nephrectomy, even if it's a small little tumor, because we follow these patients very carefully for 5 years. And the medical oncologist side of that does that. Although some urologists do in their practice, we kind of feel that, we kind of take over at that time. But certainly it's a big transition for patients that perhaps they're not entirely aware that it could happen. So it's something that we have to make sure that we communicate. And Chapman, for you, what was it like when you first met your team and figuring out who that key person was going to be to take care of you?
Yeah, the first person that I spoke to was my wife about it, and I was completely lost. So she got me into the emergency room, and I actually was assessed by the emergency room physician. And after I was assessed by the emergency room physician, they actually called for the urologist, and he came into the ER after getting out of surgery, actually, and he happened to be the head of the department of urology, and he also performed the surgery for me after doing the investigations. So it was a matter of, I think, about a total of about 2 hours for me to actually see the person. And right away, I just put my trust into them. I felt cared for, and that was the biggest thing. I felt like I had a support team straight away. Completely new to the journey of going through cancer. I think I was extremely fortunate, extremely lucky to be able to have, just the early detection happen, and then the nephrectomy that happened following. Afterwards, though, because it was such a quick process, I didn't get a chance to really process it in my head. And so that's where I feel like, getting somebody, like a psychologist or a counselor to help you through the process is somewhat important as well. I had friends and family, of course, but, with thinking about, not being around for your kids and thinking about how is this going to work, I had to move almost like it was in slow motion. Each day was very long, and each hour was even longer. So there's a lot of support out there, and joining the Facebook groups and things like that was very helpful.
Yeah. So I'm going to ask a question now, which is we touched upon. I think everyone talked about being an advocate for yourself. It's kind of a big topic, and I think it means a little bit something different for everybody. What I heard is go with your gut, and that's so important. But for other people, they're not really sure. How do I be an advocate? How do I define it? It doesn't have to be like 100%, but for some people, it may be a little bit that gives them what they need. So how would you tell somebody who is perhaps going through what you went through, years ago, to give them that boost of confidence to be an advocate for themselves? If anyone wants to jump in and tackle that.
I'll take a stab at that.
Sure.
So, it's intimidating to talk to these doctors, right? And
Sure.
You're overwhelmed. Your whole world has been turned upside down, and so it's hard. And I always emphasize that with patients in the beginning, like, look, there's no dumb questions. None of us remember high school biology, right? I don't, at least. I mean, so I had to kind of refresh myself on, basic medical terms just to be able to advocate for myself. But I think the most important thing is find where your comfort level is and know that that will change as you progress in your journey too, right? I didn't know the right questions to ask in the very beginning. It's something that I've learned along the way, and just pull from resources. There's a lot of patient resource groups. To Chapman's point, Facebook. There's also Smart Patients.
Mhm.
And honestly, whenever I joined Smart Patients 5 years ago now, that was whenever I started to understand, being able to, in layman's terms, read my reports and to know what questions to ask. And so everyone's comfort level is different. I don't know that there's a right or a wrong way to do it, but some of us are more vocal and willing to ask the tough questions than others. And that's okay. But I think really just, if something's not sitting right with you, kind of back to trust your gut, that's when it's important to ask. And if you don't feel comfortable asking your oncologist, which I hope that you would, but if you don't feel uncomfortable asking your oncologist or urologist these questions, I always tell patients, talk to the nurse, talk to the medical assistant. Sometimes it's a little bit less intimidating to talk to the other members of your care team, but they're just as important on your care team. And so use those resources as well. Maybe it's a little bit less intimidating to ask those questions to someone else on the medical team than directly to your oncologist.
Sure. So being an advocate is not one size fits all. It's doing little bits at different times for yourself till you get that comfort level that you feel good about. So again, now I'm moving on to another question. I'm gonna raise this topic, and it's one of palliative care, and I think it's important to talk about because there's too many taboos around it. But having said that, I was reading a very interesting article about palliative care, and today when we treat advanced kidney cancer patients or any type of cancer patient, we use as many resources as we can. And in this article that I was reading, which was so interesting, it said, medical oncologists are taught to treat and, give things that make things smaller. And that's our expertise. And that's what we want to do for everybody. But it's the palliative care team that helps with all the side effects that they're the experts in. So I know that early on for some of our patients, we do engage palliative care. And it can be for pain management, it can be nutrition, it can be social work, it could be for helping with the side effects of treatment. But what's the best way for us to get rid of the taboo associated with it and know that we're all working together to help patients to get to where they need to be and to give them the best care possible to treat their cancer? Because if it was as simple as just removing the tumor off the kidney, our jobs would be a lot easier, but they're not. And so we have to be mindful of incorporating everybody that we know that can provide a better outcome for patients. And that's what we try to do by asking palliative care to be part of the team management. So that was part of the questions that we wanted to talk about with the early stage of diagnosis, because sometimes we have to incorporate palliative care into somebody's treatment plan.
And it's okay. I mean, the palliative care can help you,
right,
feel better and feel like you're managing your treatments better. I mean, I know just for me, having those things when I've gone through the couple different treatment options that I have now, having that extra support, so I'm not just taking a pill and having to deal with it,
Correct.
I know I've got the support either of nutrition or just the advice of different methods to deal with the side effects that I go through. So it's not taboo. I mean, it's, yes, I'm, a metastatic person, but my prognosis is really very good because of the treatments, because of the support I'm getting with the treatments from the palliative care. So it's, like you said, it does come off as kind of a taboo and kind of gives people questions, but it's okay. It's like a support as you're going through whatever treatment.
Yeah.
Option.
Our goal is to bring all the experts that we know how, that we have in our disposal to help with patients with their care.
Yeah. I think it's absolutely crucial to have as many people involved in your care team as possible. And, in order to get the best possible care and be a really good advocate is just invite people to come into support. I did not know that counselors were available. I did not know that, these sorts of resources were available to me. And I didn't seek them out either. And so I'm, sadly, recovering now from that. And obviously talking to my kids about cancer, it's not a taboo subject. So talking to them about these other care treatment options is also not a taboo subject. And that's one of those things that I think we have to advocate for ourselves and then just say, hey, listen, we're going through a health challenge right now, and cancer treatments are very different than they were, 40 years ago. And, the resources are quite different as well. So I think it's very important for us to not have any taboos and just say, hey, look, we need help, and there's help available. Let's enjoy it.
There's so much emphasis in terms of getting the tumor out, getting, post-op care, seeing a medical oncologist, deciding if you need treatment, that it's important that we take care of other aspects of the patient and, mental health and what they've been through in a very short time, and suddenly dealing with something that is, had potentially threatened their life and changes their life. But with information and support, it makes it much easier to go through. You can't have too much information and have an excellent healthcare team to guide you through your questions and what do you think of this and what do you think of that. So we believe it or not, we only have a couple minutes left. And I would like to talk about clinical trials, because I thought that, that was something that we need to have more of and certainly have better access to for patients. So Lori, tell us about your experience and what was it like for you in terms of making the decision?
Well, like I said, I was really fortunate. My oncologist sat me down, had a plan A, B, C, D of which trials he thought I might qualify for, what the treatments would be if I decided not to do a clinical trial. And he explained to me why he thought this trial, which at the time, it's called PAPMET, since wrapped since, but at the time it was just opened up a couple months before for patients to enroll. And, he explained to me, this is the process, you're going to be assigned one of 4 different treatments that we think might, work for papillary kidney cancer. He assured me that there wasn't going to be any placebos, which I know is a common misconception with clinical trials of cancer, but, I didn't have to worry. I was going to get some type of care, right? And he assured me that if we saw it wasn't working, he'd pull me off, we would try something else, that I didn't have to stay in the trial just for the sake of research, that this was just another tool that could be used in the toolkit, right, to treat my cancer. And so I felt very comfortable with that. And quite honestly, I felt like if it doesn't benefit me, hopefully it's going to benefit another patient. But the clinical trial he signed me up for, I was assigned Cabometyx, and I was able to receive all my medication through the trial for free. And I went under the same surveillance I would have had I not been on trial. But again, those costs were minimized because of the trial. And I, like I said, I had an 80% reduction in my tumor burden within just 3 months on Cabometyx. So it worked incredibly for me. And now Cabometyx is, a lot more commonly prescribed for patients. At the time, it was pretty novel. But it was a great experience for me. And I always encourage patients to at least consider clinical trials as part of their treatment plan.
Great. Okay, so in a few minutes, we're going to open it up to the audience for questions to you panelists. But what do you think would be key takeaways, again, for patients who are going through right now similar situations that the three of you went through?
I would say, just rely on your team, and your team being your medical team, but your team is also your non-medical team, your friends, your family. They are huge in your journey in going through this. And if, I was one of those people that I was who everyone else leaned on. So it was a little hard for me to go that other way, but lean on them. That's what they're there for. And also just, if I could talk to myself 8 years ago, I would say just take a deep breath, because my journey went very fast. It was in less than 2 weeks, I was finding it out and getting the nephrectomy. So it went very quickly. But just, if I could take just a couple deep breaths, even though it was extremely scary, but just kind of having some faith in my friends, my family, my team.
Sure.
Yeah.
Oh, great.
Sorry, Marissa, that was
yeah.
Just to echo Marissa's point, you will find a strength inside you that you did not know existed before, and lean on that. You will find that within you, even whenever you think, I can't do this anymore, this is too overwhelming. You will find that, and that's what's going to help you power through. So I always encourage new patients, know that science has changed rapidly just in the time since Marissa and I were diagnosed years ago, right? There's new treatments on the market now that we couldn't have even imagined then. There's new treatments coming out. Rely on your team, take good notes. I even used to ask my oncologist if I could record our sessions, on my phone and voice memos, just so I could listen to it at the end. And just trust your gut. You'll get through this, and there's a wealth of information out there and patient groups that are more than happy to support you through your journey.
Mm-hmm. Yeah, something that I wanted to mention is that the biggest thing that seemed to help me is actually sharing my journey. I actually shared it quite openly, and I find that I think that female cancer survivors are very vocal, and it's a wonderful thing. And I find that there's not a lot of men sharing. And I think it's important for men to share because, it's a tough spot to be vulnerable. And it's a challenge, I think, for us to do that. But having done that, I've actually encountered a neighbor who I supported through his kidney cancer. Wow. He's 68 years of age, and it was just in passing. And then there's a gentleman that's been raising money for kids for Toronto sick kids, actually. And he's been doing it for 6 years. And I found him on Facebook. And this year, he's actually actively got an aggressive prostate cancer that he's going to treatment for. And so it's one of those things that, it's said that 1 in 2 Canadians will get cancer at some point in their life. And the more I share, the more I'm finding that there's connections to it. And I think it's important for us to be, vocal, because we're a part of a unique club of survivors, and that we can actually be resources for other people. The fact that we have survived, and I'm just inspired by all the sharing that you guys do, and how it's opened up the doors for communication, especially on social media.
That's great. All right. Well, thank you all for such amazing points of view on sharing personal experience. with us today. It's just been, I think, extremely helpful, and like the way you all rely on yourself, which is, something that we tend not to give ourselves enough credit for. So if there's any questions, we can take them now from the audience that they'd like to ask. We're open and ready.
See, there's one popping in. Okay, it's just a nice comment that someone is letting us know they were diagnosed with stage 1 renal cell carcinoma in May and had a partial nephrectomy June 28th. The surgeon said that there were clear margins and they thought that their journey was pretty much over. Now having the 3-month scan in 10 days, I'm a bit nervous after hearing your stories about recurrence. So what type of information can you sort of support and encouragement that you can give him or her to with what they're facing here in terms of that follow-up appointment?
The dreaded anxiety.
Yeah, anxiety. Yeah, it's true. It happens to all. It happens to me. I get anxious. I'm 2 years NED, and I still think, I still keep looking over my shoulder, so to speak. And it's something that I think has always been troublesome, and that's something that I'm vocal about in terms of mental health and anxiety. Take a deep breath. I believe, I've got anxiety with that and issues with confidence now because of it as well. I don't have any more to add than that. Deep breathing and, you've got a good support team, rely on them as well.
And I would just like to add that how important it is that the practitioner wants to get those scans in 3 months, as opposed to saying, oh no, I don't think we really need to do it. We got everything. The doctor's being proactive and following guidelines and doing what everything possible that needs to take place for a better outcome. So that's a positive thing to focus on.
I always say, your cancer didn't grow overnight. So, 10 days from now, the answer won't be any different than it is today. But, making sure to the point here that, your practitioner is following guidelines, which it sounds like they are. Those guidelines are easily found online. And it's just important to keep up with your surveillance scans. Everyone gets anxious around scan time. That doesn't matter what patient you are, right? But just following up, and if you are concerned, it's okay to ask for a second opinion. It's okay to make sure that your doctor is a specialist in kidney cancer. Ask, how many kidney cancer patients do you see a year? It's a little bit of a tricky cancer, and if you're the first, maybe you do want to go ask for a second opinion, but you're doing the right thing. Your doctor is following guidelines, and just stick with it.
Great. There's actually one more question that I think is something that I haven't seen addressed in a little while. How do you deal with when you get a new diagnosis and talking with your kids about this? Someone out there has some kids that are age 7 and 11 and really trying to talk about that diagnosis without causing, extra stress for the kids because they have their own anxiety. We all know that's definitely there, but how to manage that for your kids?
Mine were actually 8 and 11, so very close to that age. I have to admit, and of course, when I had my diagnosis, I was feeling fine. I wouldn't have even known I had kidney cancer, but had the radical nephrectomy, and I chose not to share right away with them. Honestly, I let them know, something was wrong, but I was getting it taken care of, and just kind of left it at that, because once I had my nephrectomy for a little while, I was clear. You have to do with your kids what feels right for you, and depends on the kids, maturity as well too, and their understanding of things. At the stage of my journey and how things were going for me, and since they had at that time gotten all of the cancer, I felt it was okay to hold that back, let them know I wasn't feeling well, but not really elaborate on it. But you've heard us say, go with your gut. I think a little bit of that is go with your gut, and your children and how they may handle something this big, and maybe just a little bit of sharing, maybe no sharing. It's do what's right for you, with your journey. Your gut will tell you, what's right to share, and if you feel like you should share now, or maybe a little on down the road.
Yeah, I shared straight away with my kids after talking with my wife, and we talk about medical things around the table, and dinner table, lunch, and things like that. And for us, it was comfortable. For our eldest daughter, she needed information, so we went to the local library, and there happened to be books that are age appropriate. Talked about the CT scans, talked about the biopsies, talked about the treatments of radiation and chemotherapy, and it really gave it to them at a level in which they could actually understand. And actually, it helped me understand, because I didn't know anything about these things either. And so these children books are really great. And they have them at the local library. They even had them. I even went as far as to ask the school library to get a copy of it, because it's a scholastic book. And I thought it was a really great resource for us, because maybe grandma, grandpa, or maybe aunt or uncle will be going through something. And if it's in the school library, they can actually read about it, and then it becomes something that's a little less intimidating.
Mm-hmm. Thank you. Great responses.
Great. It looks like we are ready to move on to the next presentation. So I definitely want to thank all of you for giving us that perspective. Everybody's story is different, but sometimes you learn just a little bit of things to get you through your own story and your own journey by hearing other people. So thank you very much.